Next question. The data used to populate COVID-19 community levels is sent to CDC by local health departments. That's the first question. If so, would it be fair to assume that the differences in the surveillance systems of local and state health departments can influence the data, making it difficult to compare levels between states? And I'll direct that to Captain Ritchie.
So as Dr. King mentioned, there was 3 component measures that go into the COVID community level indicator. The first 2 are the hospitalization data. So the hospitalization data are overseen at the HHS level, meaning coming from the federal government as far as giving guidance to hospitals for reporting that data. How those data come to CDC sometimes passes through the state health department first or comes directly to us through the mechanisms that we've established. So there really isn't, it's pretty clear guidance, and that guidance is consistently applied across the country on the hospitalization side. As far as it relates to the case surveillance side, that third part of the COVID community, there could be a little bit of iteration there between states and locals about how they're defining cases as far as reporting confirmed cases only, or some reporting also probable cases. So there's a little bit of variability there, but there's strong consistency on case definitions that are being applied across the country. So while there is a little bit of variability, it's not overly likely impacting those measures as we get down to the local community, to the county level. So Dr. King, if you want to add to that, please do.
No, I completely agree with Captain Ritchie, and I think it ultimately comes down that the requester is right, that there's going to be some variability, but ultimately we help account for most of that with that definition. And as was noted, we do have standardized definitions that are set by the Council of State and Territorial Epidemiologists, or CSTE, and they have very clear definitions around confirmed and probable cases that we ultimately use. And so although there is some extent of bias, I would agree that it's limited, and we help account for a lot of that by making sure we use that standardized definition with the data that we do have.